Since 1989, Florence Nightingale Hospital serves as one of the most advanced and impressive centers within the region. Within the group, there are 4 general hospitals with a 700-bed capacity, including a state-of-the-art smart and green building, 2 medical centers, a teaching hospital, a nursing hospital, as well as the Istanbul Science University.
I had my transplant training at Ohio State University in between 2001 and 2004. And I furthered my studies 1 more year, especially focusing on pancreas transplantation and laparoscopic donor nephrectomy procedure. When I turned back to Turkey in 2005, I started one of the first kidney transplant program in private hospital at Florence Nightingale Hospital. And during the past 10 years, we did more than 600 kidney transplantations, and right now I am very happy because I have almost the same organization and the same program just like Ohio State. And more than that, also we have the same success rate with the advanced transplant centers in the United States. Well, it's very difficult to ask for a gift of life, to ask for donation of a kidney from a relative.
I had a kidney transplant from my mom.
My donor is my dear sister.
When you have such a chance, then you don't want to have any mistakes and you want a very healthy life with a new kidney.
I've been suffering this kidney problem for 15 years. And I found Florence Nightingale.
So the rate of hospital discharge with a functional kidney is 99.8 in our series. So that's all of the patients are going home with a functional kidney. And our 1-year success rate is 97.6%, and our 5-year success rate is 91%.
I get my kidney transplantation almost 7 years ago, and everything is good right now.
Dr. Baris has told me your sister gave you a Ferrari.
We are a referral center for challenging cases. We have a very experienced team, both in the operating room and in the service. And also we are a comprehensive transplant center where liver and bone marrow transplantation is actively done. And Florence Nightingale Hospital is a university hospital, and Istanbul Bilim University is another important source for our consultations to experts in their medical branches.
Our center is successfully carrying out all required tests for renal transplantation by having accreditation from European Federation for Immunogenetics. Additionally, we have started next generation system. It's a very high system at the moment for tissue typing, and also we are doing it in first time in Turkey.
Patient and the donor comes to the hospital. They are evaluated in detail. This is mainly some immunologic tests, some blood tests, urine tests, and radiologic examinations. This process generally takes a couple of days, 2 or 3 days, and then the patient is hospitalized to have the kidney transplantation. After the transplantation, generally the donor stays in the hospital for about 3 days and the recipient stays in the hospital for about 6 days.
The safety of the donor is the most important factor in living donor transplantation. Our special surgical technique enables safer surgery for the donor. We perform hand-assisted retroperitoneoscopic donor nephrectomy as an alternative approach to laparoscopic donor nephrectomy. This is an advanced technique avoiding intra-abdominal complications of laparoscopic surgery. Because we are not entering into the abdomen with the retroperitoneoscopic technique, we are not touching into the abdomen, and this avoids the intra-abdominal complications like abdominal adhesions and injury to the abdominal organs. Sometimes the patients have a donor, but that donor is not suitable for giving a kidney to that recipient, to the patient. It's when the blood groups are not matching, or it's because the recipient has hypersensitization against human tissue, has high PRA. Well, we have solutions for all these problems. We can offer ABO-incompatible transplantation, also offer paired donation.
Florence Nightingale Kidney Transplant Center has been performing paired kidney exchanges for years. This kidney paired donation transplant enables 2 incompatible recipients to receive healthy, more compatible kidneys. The transplant procedure for both couples starts at the same time and the kidneys are exchanged during the surgery. the two couples wake up from the surgery with a successful kidney transplant. All medically eligible donor-recipient pairs may participate in our paired kidney exchange program. Couples from abroad are invited as well.
10% of our transplant patients are high sensitized patients. This group is a very important group where you need to have very good tissue typing support to have donor-specific antibodies. In this group of patients, we have success rate almost similar to normal transplants, and we have a special program to follow up high sensitized patients.
Post-transplant follow-up program is a major step to achieve long-term success after kidney transplantation. Our patients are trained about the medications and the new lifestyle after kidney transplantation. We monitor the blood levels of some immunosuppressive medications and follow up the kidney functions with tests after kidney transplantation. Patients can reach us anytime from their home countries, and we follow our patients lifelong after transplantation.